So you guys were in the same PT class
Yep.
at
Yeah,
Dominican
yeah,
College?
yeah. We met
That's
at
what's up.
Dominican College. Yeah, yeah, man.
That's so.
We have our
Like
last
since day one or what?
since day one.
Word.
Yeah,
Oh,
One.
oh, where?
yeah. He's from
Day one.
Queens too.
Oh, really? Where do
Queens,
you
Long
live?
Island. Yeah.
Rosedale?
Oh, snap, Long Island.
Where do you live?
I live in Jackson Heights.
Oh, cool, man.
Yeah, Long Island's kind of deep for me.
Yeah, it is.
Yeah.
It is. Wow.
But
yeah.
it's nice there though. Like you got nice neighborhoods and stuff.
Yeah, for sure, man.
Yo, Sam, what have you been up to, man, since college? So KB, I went to college with Sam. Like we both went to Hunter,
Oh, okay. Cool.
and we took like the same classes, like chemistry, orgo, things like that.
Yeah,
Physics,
it's crazy. All the science classes.
all the science
Yeah,
classes.
So
Yeah.
yeah. So since I graduated, I was like you knew I was originally like pre-med,
Mhm.
and I feel like after like I hurt my back,
Yeah.
I told you about that. Like I herniated a disc,
Yeah.
and then it got to a point where I couldn't even sit for like even like a minute, like 5 minutes at a time because
Wow.
of the like
It's not
discomfort and
bad.
pain. So I was like, yo, with this much back pain, like I can't. There's no way I could get through med school. You know what I'm saying?
Okay.
You got to sit for and study for hours. Like,
yeah. Yeah.
So I was like, that's not something I can do at the moment.
But you were
And
ready
then,
to like apply and everything.
Well, at that point, I was studying for the MCAT. So like, I was just getting into like studying for the MCAT. So that's when I was like, okay, maybe I can't do this right now at this point in my life.
Yeah.
Right.
And then I started, going to all these different people. Like I tried seeing like mad different doctors, PTs, and unfortunately, like nothing was helping me. Like nothing was giving me relief for my back, and
Right.
like they couldn't give give me answers to why I was having so much pain and why it wasn't getting any better. And then it was only until like recently where like my brother like he did a lot of research online, and he found like he went through a lot of like PT programs, and he found this really evidence based guy, Brent Brookfish. I was telling you about him.
Yep. Yep.
And the course he found, like the stuff he teaches is not even for like the layman.
Mm-hmm.
But I feel like with his model of like release, corrective exercise, and like meshing everything together, like we started like learning the routines,
Mm-hmm.
and then kind of like self-taught ourselves, and like now I'm back to like squatting and deadlifting.
Wow.
And like it was like through that exposure to like PT, like I was like, this is something I'm actually passionate about. So I've like considered like doing
Okay.
PT.
Okay.
So I actually worked at a PT clinic for like the last year until like COVID hit. So
Were you like an aide there?
yeah, I was an aide, and then what's it called? Yeah, I was furloughed after like we stopped getting patients
Okay.
because of COVID. And yeah, so since then I've been like looking at different options.
Okay.
I applied to PT school, so
Cool.
Yeah.
How's your back now?
it's way better. Like from how I was just like I would say like 6 months ago.
Yeah.
Like I was so stiff. Like if you saw me moving, bro, you'd think I'm like an 80-year-old.
Right.
Like that's how my mechanics became. Like I became so stiff because of the pain, and I was like when you have pain for so long, you start moving in like ways to avoid it, and it makes you really stiff.
Yeah.
And like so, basically everything I do is like really uncomfortable. Like even if I tried like picking up a pencil off the floor, it would be like I'd have to do it carefully and
Mm-hmm.
like
And you're thinking about it, and you're like anticipating pain, and you're like so used to that.
Exactly.
Yeah.
And then like so recently I've been doing like a lot of release work on my piriformis, and
Okay.
that like basically got rid of like 90% of my pain.
Right.
So like after that, and like integrating that with like corrective exercise, and
Yeah.
like really strengthening my glutes and my
Core, right?
glute medius and
Glute medius,
core, like that.
Yeah.
That's helped tremendously. Like now, like I do ball wall squats, but
Okay.
like I'm up to like 30 pounds.
That's awesome.
Yeah, like I hurt my back 6 years ago, and
Mm-hmm.
since then I wasn't able to squat or deadlift comfortably. And it's only until like the last 6 months where I could squat and deadlift.
Wow, man, I'm really happy for you.
Yeah.
Yeah, the power of PT is amazing. Like, it
So
really
when
is
you see
powerful.
when I saw like that experience in my life, like how it's completely transformative,
Yeah,
and like it gives you hope, like okay, you don't have to suffer in pain forever. Like that's
exactly.
kind of like what I was imagining like my life would be like. I'm like having to deal with back pain from such a young age.
Yeah, it's
It's kind
scary.
of like, yeah, man.
Yeah. No, man, it's the power of physical therapy is amazing. Yeah. So yeah, you can if you have any questions for us about like PT, like applying or like the field in general, or like any kind of confusion you may have on anything, feel free to ask us some questions.
Yeah, sure.
Yeah.
What was your experience like in PT school?
So for me, it was tough because when I first applied, I got rejected from like 12 programs. Like I applied everywhere. Right after Hunter, I applied like out of state, in state, upstate, and pretty much got rejected everywhere except for DUVO College up in Buffalo. So at the time, I was working as an aide in the city, and I was put on the wait list for Dominican College, and I was put on the wait list for DUVO College. And then a week before classes were supposed to start at DUVO, it was like June 13th. I got an email saying, you were taken off the wait list, and you got accepted into DUVO. Like, do you want to accept this? And like I
Oh
was like, I
wow.
don't know what to do. Like I have a week to pack up all my stuff and literally move upstate. I didn't have anything ready. I didn't have a car. I didn't have money saved up. So I honestly just told them like, I appreciate the opportunity, but I'm not gonna be able to do it. And that was like one of the hardest things because you want it so bad, you want to get into school, but then like to tell them no because it's not the right fit at the time, it's tough. So I waited a year. I reapplied, got waitlisted again to Dominican, and then eventually got taken off the wait list, and I got accepted to Dominican College. And honestly, it was like the best thing that could have happened because, like KB will tell you, Dominican College is like one of the best programs out there right now.
That's so
Super,
good to hear.
super evidence based. Super, like the professors are all manual based. Like they all have certifications in like the highest orthopedic manual physical therapy like certifications that exist pretty much. We have like 5 or 6 fellows of the Academy of Orthopedic Manual Physical Therapy. We have people who are certified in like neuro, orthopedics, geriatrics, women's health. Like it's a very diverse group of professors. But in general, it's challenging. It's a challenging program, but it's really like fulfilling and rewarding. KB, if you want to add anything like your experience?
Yeah, nah, for sure. Definitely, similar experience. So for me, out of undergrad, I did apply to like, I want to say like 8 to 10 programs, and I got rejected from most of them. Toward the last two that I was really interested in would be Dominican College, Mercy, and there was a school at the time that was close to me, Gannon University. It was relatively new, so that was actually the first school that accepted me. So I was done with school. This was in like December. They accepted me, or I went to do their interview. I went there, similar to Sam's experience with his school, Deweyville, whatever. Like, it wasn't the. I just felt it just wasn't the right fit. It was a brand new school, just in the middle of nowhere. I literally remember just like opening up the pamphlet, looking like how much is this school, and it was like, oh, like 200 racks. I was like, okay, like, and I was like, yo, like, where's the scholarships at? And like, oh no, we're just starting, we don't got that. So
Oh.
I just went, I went back to New York. It's like, all right, cool. Like, you got to take a risk, right? Because like Sam's saying, it's like you waited so long for this, you worked so hard, someone finally tells you yes, but then you got to think about what's best for you.
At that time, exactly.
I feel like at times with PT school, I feel like it's almost like a lottery system, right? So just because Sam and I and other people, might have not like got into a lot of schools doesn't mean that we're going to be bad therapists. It's just I really just think it's like a lottery system. Truthfully, like I feel like everyone in our class was almost on the wait list. Yeah,
Really?
like
Wow,
everyone's gone through
crazy.
their own story. I can guarantee you, like 80% of the people in our class, um, like had something crazy happen. Like, it's
Struggles, yeah.
no one's going to get into 10 out of 10 schools. You know what I mean? That's why I just think it's just a lottery system, and whatever you believe in, that's really what's going to help you pull through.
No, I
Yeah.
definitely see that. It's the passion that makes you that determines whether you're going to be a good PT or not.
Hmm.
It's not whether you got in on your first try or you had the best grades or
Absolutely.
Yeah, patients really don't
it's the
care about
people.
that.
Yeah,
Yeah, I'll
it's
tell
like the
you.
PTs who really dedicate the time to look at the science, look at everything, try using the best modalities, like that actually care about their patients.
Hmm.
Like those are the ones that end up being the best PTs. So just getting that opportunity, that's amazing. I'm glad that you guys were able to get
Yeah.
in and pursue like PT.
I'll tell you one thing. What I feel like those PT students in my class or in other institutions, those who like had a gap year who didn't get in, I just feel like they have like just more of a drive, man. Like like I got in right after undergrad by the grace of God. Like I just got lucky. It's not because of merit or anything. It's just luck. You know what I mean? But I feel like those who took a gap year or two, they just like Sam or other people that I know, it's just like damn. I remember that year. I remember making $12 an hour as an aide. I remember my parents looking at me like, "Listen, what the hell are you going to be doing?" I just feel like they don't take anything for granted.
Yep.
And they're really just trying to work hard. That's just something I picked
Hmm.
up on.
Yeah, our class, there's a lot of strong personalities, and that's something that's great about Dominican college. It's like really diverse culturally, socially. We're very good with people. We know how to talk to people. We know how to connect with patients. Cause like, you can be the best PT
Exhibit
like
A,
book wise. What's that?
Exhibit A, you.
You could be the best PT. You can know the best science, evidence based, but if you can't connect with your patient and you can't give your message to that patient, they don't care how much you know what's here. You have to vocalize it and communicate with them. So that's something that Dominican like really focuses on. One of their pillars is like professionalism, research, things like that. So another good thing about Dominican with our experience is that it's a weekend program, and I feel
I
like
was
a
just about
lot,
to ask about that.
right?
Yeah. Wow.
Yeah. So like a lot
Mhm.
of people are deterred from that. They're like, oh, it's a weekend program, and it must not be good because it's weekends only. But at the end of the day, it's actually better in my opinion because it allows you to continue working during the week and building your clinical experience as an aide in whatever it is you're doing as a trainer. You're continuing to build that clinical experience, and the professors that you have work during the week, so they're not like behind on what's going on. Like a lot of programs, not to mention, I don't want to mention names of programs, but certain programs, their professors are really old school and they pretty much haven't treated a patient in 20 years.
That's crazy.
And they literally just teach off the book, but can't relate it to a patient. So to me, that's more of a deterrent than a weekend program. So something that I love about Dominican is that the professors are continuing to treat during the week, have their own patients, talk about them, and then on the weekends we learn from them. So I think that's great.
That's
Yeah.
that's amazing. Wow.
And
I
another
didn't
thing,
know that.
Yeah.
the whole like weekend versus weekday. People think weekend programs are not really in class as much, but if you really break it down to like the hour, we're probably in class more than the average person on the weekday. So weekends, including Friday, so Friday, Saturday, Sunday, first 2 years, 8 a.m. to like 5 to 6 p.m. And that's straight with an hour break. So that leaves you almost like 8 hours straight, 8 hours per day, right? Times three, so that's 24 hours. And then so on, most PC programs, it's from Monday through like Thursday. Again, they're not doing it 8 hours a day. It's probably like 4 hours a day, right? And then even though we're Friday to Sunday, almost every week, you're meeting up with your classmates at least one day between Monday through Thursday just to talk about whether it be research or you might go up and see your advisor. So contact hours, I thought I'll be like missing something because it's over the weekend. But like now that I'm almost done by the grace of God, I just feel like I've been in class more than other people for sure.
Yeah.
Like our endurance is
Oof.
Well, Sam's endurance is like crazy, but like the average person endurance has been crazy in our class.
Yeah.
Wow, that's actually crazy to think about because you'd assume like you're in class less because it's just the weekend. And is it every week or
So for our program, it's usually alternate weekends. So we'll have, like, let's say you're a first year student, you're in your first semester. You're gonna have class Friday, Saturday, Sunday, like KB said, 8 to 5, 1 hour break, 12 to 1 most likely, and it's every other weekend. However, there are some weekends that are back to back. So you're gonna have, it just depends on the schedule, depends on the class. But over time, you start to develop that endurance, and you start to, build that character. Like, I can do this. Even if it's long hours. Just the program gets tougher, but as a student, you get tougher as well with it. So
and you guys so basically you have to cover so throughout the week you're like covering the content for the next week or reviewing for the past week.
yeah, so during the week, I think I forget the stat, but like for every hour that you spend in class, you should be studying 3 hours during the week.
Damn.
So during the week, you're studying for the last weekend what you learned, but you're also preparing for the next
In the
weekend.
next
So it's a lot of material, and you have assignments as well during the week. You're doing like what we have. So our program has something called CATS, CAT. It's called Critically Appraised Topic. It's basically an independent component for every single class. And like I said, one of the pillars of Dominican College is research. So what they focus a lot on research, and every class they make us do a literature review on a certain topic, and they make us kind of compare like randomized control trials or like systematic reviews, meta analysis. They make us compare that research article, and then we have to kind of write like a literature review about that article and all our comments about it. So definitely a lot of assignments and busy work during the week, but it helps to like enrich the learning experience.
That's crazy, yeah.
Yeah.
So like in terms of like the actual curriculum, like what is the most shocking thing that let's say you've learned in PT school that you didn't know otherwise?
You can take this one, KB.
Yeah, that's a great question. So one thing I've noticed really, now that I'm on the tail end is just how holistic the field is. I mean, I'm thinking, looking back, the amount of classes that we're learning, you're thinking that's only what a medical doctor should be assessing. So you're thinking like, just a lot of like medical type diseases or things like that. You almost have to know just as much as they know for many things. It's not just how well someone's moving, or it's really how well they might respond to certain movements. So you really got to understand the underlying causes of what's going on. So yeah, really just the holistic aspect of the field has changed. Like this literally certifications with lymphedema patients. Like you would never think that that's like a PT's job. You would think that's like a doctor's job or something. There's certifications for PTs with cancer. Sorry, patients who have cancer, and they should know basically how they should respond. There's certifications with pediatrics, like, and there's things that you have to understand how they might respond with certain medications and things in that nature. So really, just the holistic aspect. As a PT, when we're starting, we're entry level PTs, so we should understand a little bit of everything, and that's kind of something that I've appreciated, the whole holistic aspect of the field.
Yeah, for me, I think that's a great word, like shocking, because I was lit when we took clinical education 2 with Dr. Rodriguez and Dr. DiCarado. Actually, Dr. DiCarado, KB, was in the same class as Brent Brookbush at
Oh wow!
Hunter, which is the guy that Sam was mentioning that helped him kind of help
Mm.
his back. So
Full circle.
everything is full circle. The PT world is a small world. That's what we all learned. It's a very tight knit community, which is great. But I like the word. I like that you use the word shocking because I was literally sitting in clinical education too with all my classmates, and when I started to learn like the material that they were presenting, I knew it was something super unique to Dominican. I knew no other program was doing it because I had actually been waitlisted for Mercy College, I didn't mention, and I took one of their courses in the summer, and then they rejected me. And just being around like that program, it didn't seem like it was something that was unique or that was going to teach me anything different, you know? So basically, we learned some, like KB said, holistic way of assessing and treating. So we learned the concepts of regional interdependence, which is basically like the whole body is one kinetic chain. So like I was mentioning with you, you were mentioning your low back pain. A lot of providers and doctors are going to look at your low back pain and just focus on your lower back.
Isolated.
They're going to isolate it. They're not going to address the joint above and below, or even like the foot, even like your dura and your spinal cord, um, your thoracic spine,
Or you're
our
like
program
flat feet.
flat feet. Our program focuses on your rib cage, your thoracic rings. How can that affect your movement? So that's something that we learn. We learn to do a top down or bottom up approach in assessing using our hands. We stabilize certain areas, we give them cues in different areas, and we see what helps the movement pattern the best. Whether it's the quality, whether it helps to decrease your pain, our corrections using our hands or cues, it's a way of assessing the body like in a systematic way. So that was like the most shocking and like amazing things about our program. Because like with you, right? A lot of people have herniated discs, right? So your lumbar spine is flexed too much. But we have to ask ourselves like why did it flex so much? Right? Is there a region in that nearby area in your pelvis, in your abdominus, in your hips, in your thoracic spine that's maybe moving too little that cause a compensatory hypermobility in your low back and it caused that disc to herniate? So in your case, we were talking about that you also had hip impingement, right? So that can affect the lumbar spine. So that's something that Dominican like teaches us to address, like a whole systematic, holistic way of assessing and treating.
That's amazing, bro. Like just hearing that is like, wow. So you're telling me in other programs they don't have that kind of level of like holistic, um, having that holistic approach?
I believe that they do because like physical therapy is really it's advancing and pushing forward, and like we know at this point like your shoulder and your shoulder blade are related, but how do we know what has a more effective effect on your pain or movement? So I think what our program does is we use our hands at different regions and we provide different kinds of techniques and corrections at different regions that helps us identify what's really the problem. So I think our program takes it a step further.
I think that's awesome because like that's one of the biggest things that I've learned. Like when I was self rehabbing, like even though my pain was in my lower back, most of the stuff I was doing was for my hip,
Hmm.
and that in turn like helped lower the pain I experienced.
Exactly. Yeah. Yeah.
And you realize a lot about yourself too. Like, oh, this part of me is
Hmm.
hypermobile, and my hips are really stiff. I really got to work on that.
Hmm.
And then you start. It makes sense. Like that approach lets you know, like you really get to the bottom of the issue. You get to the root of
Exactly.
the issue, and that's like the most important part.
Yeah.
Because even if you isolate one part and you help alleviate the pain, what's to say it won't come back because of
Exactly.
those same patterns that they had?
That's a
So I
great
think
point.
that's beautiful.
Yeah, it really is.
Yeah,
Yeah.
absolutely, man.
So Sam, I have a question for you. So when you were
Oh
working as
no.
an aide, right? So
Yeah.
at what moment was there a moment that you realized, hey, I want to do this. Like I'm actually interested in this. Was there like a patient that you interacted with or like a specific diagnosis that like with the patient that you interacted with where you had kind of had that moment like, this is something I see myself doing?
Well, yeah. So what's actually funny is so I mentioned in the beginning that when I was talking about my injury and how my whole journey and how I saw different PTs and different doctors and how I was trying to find relief for my back. So the first few PT clinics I actually went to were like one of those independent clinics, private clinics, and they would just like massage me and then like be like, oh, how's your pain now? and just do some of the electric therapy and like just hope it gets better.
Heat and ice, heat and stim.
Yeah, that's basically all they did with some massage, right? And I was like, if this is PT, like how is it supposed to help? Like it's just like treating the symptoms, right? So I was like, um, at that point in my journey, I thought that's all PT was. But then I was like, wait a minute, I know that can't be it. Like, so I was like, let me actually work at a clinic. I actually want to like hands on, get my feet in the field to know what it's like. So one of my friends actually like was quitting her a job at professional physical therapy. So I was like, you know what? Let me apply. And she put in the recommendation for me, and then I started working there. And I was just amazed, like from the first day. Like I saw how like methodical everything was. How they logged everything on the on like the flow logs and stuff. Like they'd actually keep track of your progress and everything. And that was like a stark contrast from what I experienced, like at the private like acupuncture clinics. And I also noticed that they actually did evaluations. So that's one thing they didn't really do when I went there. Like they just asked me, "Oh, where's your pain?" And like would ask me very like general questions. They didn't really test anything. They didn't test my range of motion or anything. But over here, I saw like, oh, whatever they come in for, they're evaluated. The PTs really try to get to the root cause of what's causing the issues. Like they'll test the range of motions. They'll really get like a whole try to get the whole picture, and then they try and determine what kind of exercises and what kind of treatments to give them to help improve, to help them get better, right? So where was I going? So and then I was just comparing that to like my previous experience, and I'm like, okay, these guys weren't legit because this is how it's actually supposed to be done.
Right.
So that's kind of what like spurred me into like, okay, wow, this is like evidence based. But one limitation I did notice in my clinic was that I feel like some of the PTs were a lot more like local, like they would just isolate the body part, and I noticed that I don't know if it's like the healthcare system in general and how like insurance works, because like if you have a script for only like your shoulder, that's all they could treat. Like they can't really, like they won't really give you stuff. Like let's say you have lower back pain and it was being caused by like flat feet or something. They wouldn't like give you stuff for your feet and just like focus on the lower back pain. So I guess I saw things that I really liked and that were promising, and there were things that I like kind of like disagreed with.
Yeah.
But like you said, like when I hear stuff like the curriculum at Dominican college, I'm like, wow, that's really reassuring, and that should be like the future of PT,
Yeah, definitely. So there's definitely insurance limitations, but the biggest thing is like when we're documenting our notes. Let's say a patient's coming in for their low back, but we do our assessment and we figure out that their flat feet is related to their low back. The biggest thing is connecting the dots. The insurance company wants to see you right in the document. Patient presents with pes planus that is causing more pressure to their low back facet joints or something like that. So we have to kind of connect it. We have to kind of be smart with how we write our notes. I think
so. So what you're saying is there is a way to.
There is a way. You can't just write you can't just write. I gave a patient an exercise for their feet and not connect it to how it affects their low back. And that's something that I learned during my clinical right now. I'm at an outpatient clinic. And something that my clinical instructor taught me was, you have to be really smart with how you write your notes so that the insurance company really understands like how the body is connected, because a lot of insurance companies really see things like very black and white, and they're not seeing how all the joints connect. So you got to be really smart with how you write our notes. Let's. I actually we want to see you move a little bit.
Oh yeah.
Yeah. So if you don't mind, like let's see you do some forward bending.
All right. Let's
Yeah.
do it. It's funny because my brother's over here. He's working out too.
Oh yeah.
Yes.
I wasn't expecting this part, so I'm gonna just move some stuff
I want to
around.
keep. I like keeping people on their toes. Yeah.
Oh, I was actually gonna ask in the meantime.
Yeah. Yeah.
How many patients do you see like a day per day, like where you're working?
You can take this one, KB.
Yeah. So I'm at a hospital. So for me, I probably would see about 7 to 8 patients per day.
Mm-hmm.
My instructor she watches me from behind, and if I ever needed any help, she's there. So for me, 7 to 8 patients a day.
For
So
me, yeah. Go ahead. Go ahead.
no, you go first.
No, I was gonna say yeah, because KB's right now is in a hospital, so it's you're gonna see a little less. Outpatient can get a little crazy. I typically see anywhere from 10 to 12 patients a day. 45 minutes to an hour per session. It's pretty much one-on-one, but we do have an aide that helps with the exercises. But I would say 10 to 12 patients per day.
And you feel like the amount of patients you see never affects the level of care that you need to provide them?
Right now, for me, no. But I know there's some clinics that are like run-of-the-mill clinics. I don't want to mention names, but they want to get people in and out as fast as they can. They're doing manual therapy for like 10 minutes, 5 minutes. It's not really going to have a huge effect. So I think with those clinics, the quality is going to decrease. And when we're talking about healthcare, quality is really important. So I personally will never sacrifice quality for quantity. That's just the way I am. But that's not everybody, so it's hard to
So
say.
even within the PT field, there's that option. Like it's not just like a money grab. Like people just trying to PTs trying to get as many patients as they can just to make money.
Yeah, I think it depends on the clinic owner, and their views and their philosophy. Like what do they believe in? Do they believe in just making a profit, getting as many people in and out, or do they believe in like really getting people better? So it just depends on, like you said, every PT clinic is different. So it just depends on, we want to find those good places, and hopefully in the future, more good places can open up.
And to what extent is it sustainable to see like fewer patients? Like what's the balance to where you're making enough to, sustain yourself and live while not sacrificing uh, the level of care?
Yeah, I think that's like Sam mentioned. It's really depends on the owner and what their preferences are. You know what I mean? I think in the future now, that's going to be a questions that a lot of owners are going to have to ask themselves. The way insurance companies are reimbursing, it's going to change, right? They're not trying to pay us as much. So even at, companies maybe like professional, you know what I mean? Like maybe not your office, but they kind of just run it over, you know what I mean? As much in, much as out, you know what I mean? Because it's at the end of the day, PT is a business and people do have to eat. So it really just depends on, what the owner's philosophies are.
So if the owner, so it depends on the owner how much they're going to pay you for what you're doing.
Yeah, it definitely depends on the owner. It also does depend on how much they reimburse. The insurance companies are going to reimburse. So the less money they reimburse you, the more patients you have to see. But if they're going to reimburse you much more, the less patients you would have to see, which increases quality. So if you do like your own outpatient cash base, you know what I mean. You don't have to deal with any insurance, so you can literally see one person, an hour, or one person for 5 hours. They just have to pay you like $250. You know what I mean? So it really just depends on how much you're getting for your
Okay, so
service.
doesn't that mean it's entirely based on the insurance company then, or
It has both roles. It just really depends on
oh,
what the owner is going to do with the money.
oh yeah, okay. So
Yeah.
they get the money from the insurance companies and then they determine how much to pay you.
Right, exactly. Depending on how big their business is.
That makes sense. All right, I think I
So,
gotta.
that's how you bet. Yeah.
Yeah, we have a few minutes left, so we'll see how Sam moves. We'll wrap it up, and then
You
I'll
see?
send another Zoom link, and we'll finish up.
Can you see me?
Yeah, we can see you perfectly. Yeah. So yeah, so let's have you have your hands straight and touch your toes. Let us know if you have any pain with that.
Without bending the knees.
So what you did right now, was that natural or not natural?
That was natural.
That was natural. So what did you see anything there, KB?
Not do it again.
All right. Not he changed it a
Yeah.
little bit, but definitely you bend your
The
knees.
first time I bent my knees. This time I didn't.
Right. So you
did it.
you subconsciously bend your knees when you forward bend.
Yeah.
Okay. So that's definitely a compensation, right?
Yeah.
Let's try it again with your knees straight.
You mean okay.
Yeah, legs straight. Come on down. Yeah. Okay. Do you feel any tightness in your hamstrings?
Yep.
Yeah. So that definitely when you're bending the knees, definitely hamstring shortness. I don't know if you do hamstring stretches.
Um, not at the moment,
Not at the
actually.
moment. Okay. You can definitely add that. So let's have you go on your back.
Would you be able to see me?
Yeah, we can see you.
Or should I tilt it down?
I tilted down a little bit. Yeah. So this is like a quick assessment we're just doing, right? So you're gonna bring your knee to 90 degrees, your hip and knee to 90 degrees. Yeah, right there, right there. Just one for now. All right. So I want you to straighten out your leg in that position. Straighten out your knee,
The
your left knee, your left knee. Up. Keep your hip up at 90 degrees. Yeah, yeah. Keep your hip there and just straighten out your knee to the ceiling.
Oh.
Yeah, yeah. Okay, so this is a 90-90 test, right? So this assesses like hamstring shortness. So ideally we would want the knee angle to be 0. So definitely some hamstring shortness, and that could alter the pelvis and then cause some extra movement at the lumbar. So that's something that's like a quick assessment, something that you could start to address.
Yeah.
KB, did you see anything else there?
Yeah, I just wanted to see if you could do that same thing on your right leg.
Sure.
See the difference, right?
A little difference for sure.
The left one is definitely tighter or shorter than the right. Where was your hip impingement?
Left.
Left. So
Left.
that makes sense, right?
Yep.
That definitely makes sense. The hamstrings could be a culprit there. So yeah, that's something that you can address as well. So see how quick that was? Like a couple minutes, right? You can kind of see what's going on with the whole body.
Yeah. What's funny is like they didn't even do like simple tests like that at the first PT places I went to.
Right.
So I don't know what kind of licenses those guys had.
Yeah, I know. So the minute it's gonna end the call, but yeah, I just want to thank you, Sam, for being here. Thank you, KB, for joining us.